Healthcare isn't a top issue in the presidential campaigns this year, but it's an important one here in New Mexico, especially in ongoing debates over the state budget. According to data released by the Centers for Disease Control and Prevention earlier this year, about half of New Mexicans who have insurance coverage are on a public health plan, and that includes Medicaid. The expansion of Medicaid in New Mexico under the Affordable Care Act means more low-income people in our state do qualify for that coverage, but the state hasn't been spending enough to fully qualify for a 4-to-1 match in federal dollars set aside for the expansion. It's an issue that will likely come up again in the regular legislative session in January, and all the seats, as you know, in the legislature are up for election. Correspondent Stan Wilson sat down with two healthcare providers to get their take on how Medicaid expansion is going so far and why the healthcare plans matter in the 2016 elections.
Joining me now is Dr. Andrew Shi, University of New Mexico Department of Family and Community Medicine and Pediatrics, and Jenny Metzler, Executive Director of Albuquerque Healthcare for the Homeless. Thank you both for being here.
Thank you.
Let me start off with you, Dr. Shi. Since Medicaid eligibility was expanded in New Mexico, have you seen an increase in Medicaid patients trying to get appointments at your practice?
Stan, we've had a massive increase in patients trying to get appointments, particularly men who have substance use disorders who are trying to access the system to begin to deal with their opioid substance use disorder.
Is there a limit on how many new Medicaid patients that you can afford to take in, given the surge in the enrollment of Medicaid patients?
Well, now I don't run the budgets or run the business side of it. I guess on one level that always becomes part of the equation, but the reality is if we're going to step in front of the opioid substance use epidemic, then people need treatment, and access to treatment has been incredibly limited for everybody, but particularly for men. And so the fact that they are now covered under Medicaid has meant that we have been able to stabilize whole families, which has been incredible.
When you refer to everyone, other providers have told local media outlets that they are having to turn down Medicaid patients. What are you hearing from your peers?
Well, that's what I hear, is that they will limit the number of Medicaid patients they see in order to have this mix of payers result in reimbursement levels that will keep their practices in business. And I completely understand and respect that. But on the other hand, when we're in crisis financially and we also have a patient access crisis, I guess the thing that strikes me is that the systems need to step up to address the unmet need so that we can stabilize populations and then look at cost savings.
Jenny, let me ask you, what are some of the most common healthcare problems that you see among the homeless people you serve in Albuquerque?
We see multiple problems. We have 8 to 9 presenting conditions for everyone that comes into our primary care clinics. And those are physical to behavioral health, specialty needs, based on what the rest of the population experiences, but exacerbated by homelessness and extreme poverty. So we might see more dermatological from exposure, infectious disease, podiatry problems, people are on their feet all the time. There are things that are specific to the circumstances of homelessness. We say, without being overly dramatic, that homelessness will make you very sick and kill you. So what we see are multiple, complex, severe, often long-term, untreated, multiple health problems with people that come in.
Given the magnitude of the problems in the population that you work with and the severe budget shortfall that we're seeing, are there any conditions in which you would have to turn patients away now?
We're integrated primary care, so we're an outpatient clinic. We're a federally qualified health center. We have comprehensive medical, dental, behavioral health, social services, because that's what homeless people need. The cure for homelessness, the remedy, is housing. So we do a lot of housing placement and support and work with others. As a federally qualified health center, our business model is based in our mission, and we are required, and we are committed to not turning people away if they're eligible and in need of care.
And so in terms of your healthcare providers, do you feel that they're maxed out? Are you reaching a point in which
We're always looking at that. We're always looking at capacity and access and flow and how our systems can work better to serve people. And we are seeing more people as a result of the economy, but we've always seen a lot of people. So what we will do, we will not turn people away. We'll serve them regardless of ability to pay. we also will maximize our revenues. So we bill Medicaid, we don't require Medicaid. Medicaid doesn't cover the cost of one visit for people with a lot of needs. And so we are also diversified and grant funded. So we will serve people if they need our care.
Dr. Shi, are there any conditions in which you would just simply have to turn someone away?
Well, in reality, because of contract issues with the various Centennial Medicaid providers, we have had patients who have the wrong type of Centennial insurance not be able to get through the front door to get care. People who we've seen and know and whose continuity of care we would like to provide. So these contract negotiations that affect whether people have access based on which insurance plan they carry becomes a problem. What makes it even more difficult is that they can't change their plans except for very specific times of the year. So they may go months not being able to access a primary care system they know, and because of the difficulty in changing insurance and the navigation through the system.
Jenny, healthcare for the homeless provides direct services, but how do you explain to someone who is in a transient situation about what Dr. Shi just described? For instance, if someone has Medicaid coverage and they want to go to another provider, can they get an appointment?
In some places they can. Sometimes they have to wait a long time, and when you're working every single day to survive and address really basic needs of food and shelter and taking care of yourself, sometimes those competing priorities obliterate and eliminate the possibility that you can wait 3 months for an appointment. We see
3 months?
Well, it could be for specialty care. It could be much longer. But we all, those of us with commercial insurance, you know, I'm an employer as well, and we provide health insurance for our employees, and I would be full pay, and I still sometimes will have to wait a year. I tried to get a specialty appointment recently, and I was going to wait a year for the provider I wanted to see, and there were 2 in town. Those were my options.
Did you want to add? I mean, is it in your practice, are people having to wait 3 months for appointments?
Oh, absolutely. We saw a child on Tuesday that has failure to thrive. She's not gaining weight well because she's having feeding problems. And we can't get access to a feeding clinic to address her primary issue for 6 months. Now, she's covered by Medicaid, so the providers will see her and Medicaid will pay for it. But getting in the front door to address a problem they really can't wait 6 months is a real difficulty.
So the system creates these really critical crises of deterioration of health once we even have people engaged.
Right.
And so even if my business model or our organization's business model is that we'll see people and we subsidize what Medicaid system or other isn't paying so that we can provide people the care, we don't do everything. We still need to rely on the other systems.
So as this conversation shifts to the state capitol, what is at stake, and this is a question for both of you, if lawmakers do not approve enough funding for Medicaid to fully fund coverage for everyone who currently qualifies? Dr. Shi?
Well, one very pragmatic part is that we get something like $2.8 of federal funding for every matched Medicaid dollar in the state. So every dollar that we turn away, so to speak, has an impact on whether people can get care and whether providers can be reimbursed. In addition, those dollars flow through the health providing systems into the communities, and so dollars spent in providing health care end up being cycled into other, community businesses, grocery stores, dry cleaners, kindergarten, daycare and systems like that. So it's really, in a sense, putting the brakes on an economy of healthcare dollars by turning down that financing.
And what's the most important issue that you think lawmakers need to resolve as it pertains to the service you provide?
Well, I think that we need to be funded. Primary care has already taken a hit with some of the cuts prior to the special session. We took a 14% cut, our clinic in primary care, as did these basic community-based clinics around the state. I think that's a problem. I think when you do that kind of cost cutting, you create exponentially larger costs to the community down the road, or even in the shorter term. I don't think it's even that long term anymore. And so I think investing, to what Dr. Shi was saying, investing, not leaving money on the table so that we can take care of people, so that we don't just increase costs to the crisis system and the emergency departments and all the other systems down the road.
And Dr. Shi, briefly, as a physician, What do you think it would take to retain the best doctors in New Mexico and recruit more physicians when such a high percentage of our population relies on Medicaid?
Well, I don't think we'll ever pay salaries that will compare with many other big population centers in the country. So it has to be mission. I mean, what keeps people in the University of New Mexico practices is the idea that we are serving the population that needs it the most. And it is that sense of caring for the diverse population and the mission that makes people want to stay.
We will continue to follow these important issues during the upcoming election. Dr. Shi and Jenny, thank you for being here.
Thank you very much.